To understand why NMN dominates the modern longevity supplement conversation, despite its thin human evidence base, you don't need to read clinical trials. You need to follow the money. The economic structure of the supplement industry is built on a simple principle: commodities don't build businesses. Proprietary formulations do. And niacin, whatever its merits, is about as commoditized as a compound can get. Niacin has been off patent for decades. Any manufacturer can produce it, any retailer can sell it, and competition drives the price down to almost nothing, roughly $15 per year for therapeutic doses. There's no brand moat around niacin. There's no way to charge $100 for a month's supply and justify it with exclusivity. For supplement companies, niacin is commercially inert even if scientifically valid. NMN and NR are a different story. Both can be patented in synthesis methods, formulations, delivery mechanisms, and specific molecular configurations. Patents create market exclusivity. Exclusivity enables pricing power. Pricing power produces the margins that justify the venture capital flowing into NMN companies and the influencer partnerships that put NMN in front of millions of consumers. The cost of goods for NMN is a fraction of its retail price. Markups of 1,000% or more are common in premium supplement markets. This is not capitalism doing something unusual, it's capitalism doing exactly what it's designed to do. But consumers should understand the mechanism driving the recommendation they're receiving. The promotion infrastructure follows the same logic. Supplement companies with high-margin products can afford to pay researchers for studies, sponsor podcasts, partner with longevity influencers, and fund conferences. Niacin companies operating on thin margins cannot. The result is an information ecosystem that heavily amplifies NMN while niacin remains in the background, not because the science has spoken definitively in NMN's favor, but because the financial incentives are asymmetric. This matters because consumers tend to treat the volume of promotion as a signal of scientific quality. If you hear about something constantly from doctors, podcasters, and health journalists, the intuitive inference is that the evidence must support the enthusiasm. That inference is unreliable in a market where promotional budgets and research quality are decoupled. Red flags are worth learning to recognize: proprietary blends that hide ingredient doses, animal study results extrapolated directly to human benefit claims, celebrity endorsements substituting for clinical trial citations, breakthrough language applied to compounds with months of human data. The generic-first philosophy is a useful default framework for navigating this. Start with compounds that have long safety records and strong human evidence, regardless of how unexciting they sound. Add proprietary or experimental compounds only when there's a specific, evidence-based reason that the generic option is insufficient for your situation. That framework consistently leads to niacin before NMN and saves several $100s per year in the process.